Hi, I'm Christiana Della Russo, and I'm the Vice President of Commercialization at the WBBA. And I'm here with Dave Schoolcraft, who's a partner at Ogden, Murphy, Wallace. We're here at Life Science Innovation Northwest 2014, and Dave just was on our panel. The Doctor is Online, Personalized Medicine, all about healthcare and information technology. And that's where Dave's focus is in his practice, is healthcare and information technology. And it was clear from the panel that you're really passionate about this area. So tell us a little bit about your background and how you found yourself in this area.
So thanks, happy to, and I am passionate. You did pick that up. So I've been a healthcare attorney for 20 years, plus or minus, but focused, and I lead a team that's focused on the intersection of healthcare, technology, software, information technology, and the law. And right now, we're seeing a lot of growth in that area as we see things such as changes in payment models, and we see the explosion of electronic health records, leading to a lot of opportunity for spin-off businesses. And we also see opportunities just in the change in how healthcare is delivered, and information technology supporting that. So, as a lawyer, what we really do is a lot of what I say, helping companies navigate this evolving digital health ecosystem, both to traditional business issues, building companies, but also kind of navigating. I mean, as we talk today, healthcare is a heavily regulated space, and having an understanding of the kind of guideposts and rules that govern that space is important for a startup as well as for a traditional healthcare company.
Right. So not a bad time to be a healthcare and information technologist.
It's not a bad time. I mean, we think about two major laws that were passed in the last 5 years: the HITECH Act that was passed in 2009, and then the ACA, Obamacare, that was passed in 2010. And those two laws that are, as any law, it will be implemented and the impact will trickle out over time. But underneath both of those is an emphasis on doing better things with information technology. We need to think about the difference between healthcare and banking, right? The banking industry went through some of this revolution 20 or 30 years ago, and healthcare now is just kind of, I think, on the cusp of really being able to get a return on the investment in information technology.
So sticking with the law and policy, that's one thing the panel didn't touch on was policy and the barriers that policy presents, or the shifts that are needed. So speak a little bit about that from where you sit.
Yeah. So it's funny, as a lawyer, some of the work I do is just nuts and bolts legal work, but a lot of what I do now is strategy based, and helping young companies, for example, understand where the opportunities are and also where the barriers are. When you think about healthcare, you think about something as simple as telemedicine. Okay, so the technology has been there for a long time, that we can have a physician in one state and a patient in another, and we can have a physician who has the expertise and very efficiently provide that care to that patient. But the policy is lagging in that medicine is still regulated to a large extent state to state. So it's important for entrepreneurs to understand what those licensure requirements are, for example. I mean, I work with companies that are building these digital health or telemedicine businesses. And so we spend a lot of time with them, helping them understand what they can and can't do, given the current regulatory landscape. The other thing that we do is we help organizations with advocacy, actually changing some of these rules to really be able to unleash the power and potential of information technology in healthcare.
Okay, so coming back to startups, and it's a complicated space. It's highly regulated. I've heard that we can predict what healthcare is going to look like in the future, but the timing of it is really tough. So, what are you seeing in the startup world, the startups that you are working with? What are some of the strategies they're using to position themselves for success?
So one of the, and we get this question a lot, and I think one of the main strategies that I talk with folks about is really understanding the shift in payment models. So, for example, when we move to volume-based reimbursement to value-based reimbursement, those technologies that, for example, the simplest thing is, let's help keep people out of hospitals. When you're talking about a fee-for-service payment model, there's really no incentive to keep someone from going back in the hospital. If a patient has a surgery, they have a post-surgical infection, the provider gets paid both ways. Okay? Going forward, that's not going to happen. there may be actually a decrease in reimbursement for that readmission. So from a technology perspective, building businesses that help prevent those readmissions, that help people from coming in the hospital, there's opportunity. To get there, though, you have to understand. So the strategies, you really need to understand what is going on with these shifts in payment models. And I mean that not only from the perspective of the federal programs, but insurers now are piggybacking on that.
Right.
And they're coming up with insurance products that, again, are incentivizing providers to keep folks out of the hospital.
You're echoing what Sue Siegel said yesterday when she said, old business models are out the window.
Yeah.
You really got to understand how you get paid.
Correct.
As a company. Who's the customer?
Correct.
So one last question. You hit on, we're talking about opportunity.
Yeah.
You mentioned on the panel big, huge problems, mental health and chronic conditions, chronic disease. Dig a little deeper.
Yeah.
Where's some specific opportunities?
So there's a lot of good work going on. We talked about patient monitoring. Things like and kind of fitness type applications, and we see a lot of people putting emphasis on Fitbit and things like that. And one of the points I wanted to make on the panel is that's all important, but I want to see entrepreneurs that are focused on really, really big problems, such as managing patient populations that have multiple chronic conditions and mental health problems. Now, in the past, there hasn't been incentive necessarily to do that. But when you have a accountable care organization or an integrated network that is responsible for all of the care of a patient and keeping that patient healthy, they're going to have to look at things like mental health issues. So, for entrepreneurs, for technologists that are thinking of applications that can help healthcare organizations manage those conditions, there's opportunity there.
And that's definitely where things are going.
Correct.
They're not there yet, but
that's where things are going.
Yeah.
And it's a long-term play. We talked earlier, a lot of people here, life sciences folks, they're used to that long-term. And when we talk about, my world, which is healthcare and software, a lot of software folks aren't used to that long-term play.
Right.
They're used to, going 9 months in and going public for $2 billion. And in this space, it needs to be, people need to be willing to invest over the long term.
Right. Well, thank you very much for your insights today, and we're going to sign off from Life Science Innovation Northwest 2014.